You brush, you floss, you chew a mint, and yet an awkward smell lingers when someone leans in. What if a bite, a sip, or a quick chew could drop that odor within minutes? In many common cases, certain foods and simple edible tricks do exactly that. They mechanically clear debris, stimulate saliva, neutralize sulfur molecules, or leave volatile compounds that mask or chemically reduce bad breath. I'll show you which foods tend to work fastest, how to use them safely in real-life moments, and how to tell whether a food-based fix is enough or whether you need a clinical evaluation. Before we begin, two important caveats. First, when I say instant, I mean a rapid reduction in noticeable mouth odor, minutes, not a cure for a chronic disease. Second, foods are adjuncts. They can give you fast relief and help as diagnostic clues, but they are not substitutes for professional care when the source is deeper than the surface of the tongue or recent meals. If smell persists despite sensible food-based steps and basic home care, follow the 48-hour trial and get evaluated by a dentist or ENT. If this sounds useful, comment which food you'll try first, and subscribe for the hands-on demo coming next. Now let's do something practical. Beneath the lists in chemistry, I want you to know exactly how you can test your breath right now, and what the result means for whether a food will likely help. 3 quick home checks. Do these in under 2 minutes. You don't need fancy equipment. These 3 simple checks give a fast clue about where the smell is coming from. 1. The tongue scrape sniff test. Use a clean spoon, a soft tongue scraper, or even the back of a small spoon. Gently drag it from the back of your tongue toward the front once or twice. Smell the scraper. If it smells strongly sulfurous, like rotten eggs or decaying vegetables, the tongue coating is probably a major source. In many of those cases, foods that mechanically remove debris or stimulate saliva will give quick improvement. 2. The floss or gauze sniff test. Run floss between the same 2 adjacent teeth back and forth several times, or rub a clean piece of gauze along the gum line where food usually lodges. Smell the floss or gauze. A strong, persistent foul odor from floss or gauze suggests periodontal pockets or trapped food debris. Food tricks can help short-term, but this result often points to the need for deeper cleaning and possibly professional periodontal care. 3. Tonsil check. Open wide, use a light, and look at the back of your throat. Do you see small white or yellowish specks embedded in the tonsillar crypts, or a deep indentation on either side? Those are often tonsil stones, tonsillitis, or debris lodged in crevices. A visible tonsil reservoir can produce intermittent, strong bad breath. Chewing some of the foods I'll describe can mask or lessen odor temporarily, but if tonsil stones are frequent or large, you should avoid aggressive self-removal and seek ENT guidance.
Interpretation in 1 sentence. If the tongue scrape test clears your self-sniff in minutes, you likely have a surface-level source that foods can rapidly help. If the floss, gouge, or tonsil check shows problems, foods may only mask the odor, and professional care is often needed. How we'll use that information. As you try each food, note whether your self-test result changed. If a food strategy clearly reduces the odor on the tongue scrape or floss test within minutes, that's a sign the source is oral surface and often responsive to hygiene plus targeted foods. If there's little change, document it and plan the 48-hour routine and a clinical visit if the problem persists. The science behind instant effects, a clinician's primer. When we say a food works instantly, we're describing specific mechanisms that operate quickly in the mouth. Understanding them helps you choose the right food for the right situation. Volatile sulfur compounds. These are the usual chemical culprits behind the classic rotten egg or cabbage-like breath. Bacteria on the back of the tongue and in periodontal pockets break down sulfur-containing amino acids and release VSCs, such as hydrogen sulfide and methylmercaptan. Because these molecules are volatile, they travel as a gas and are perceived as odor. Mechanical removal. Crunchy foods like apples, carrots, and celery physically dislodge adherent food particles and biofilm from the teeth and the surface of the tongue. That reduces the substrate bacteria would otherwise use to produce VSCs. Mechanical action is immediate. A bite and chew can free trapped debris within seconds. Saliva stimulation. Saliva dilutes and clears odor molecules and provides an antimicrobial environment. Chewing, especially sugar-free xylitol gum, rapidly increases saliva flow, which rinses away VSCs and debris for a period of time. This effect begins within minutes of chewing. Chemical neutralization and chemosorption. Some plant compounds bind or chemically neutralize odor molecules. For example, chlorophyll-rich herbs and certain polyphenols can interact with odorous compounds or mask them with more pleasant volatiles. Green tea catechins have been shown in small studies to reduce VSCs because they inhibit the enzymes bacteria use to produce them. Aromatic masking and sensory dominance. Chewing fennel seeds, anise, or fresh parsley releases strong, pleasant aromatics that can cover or compete with less pleasant smells. Masking does not remove the source, but it can make breath socially acceptable for a short window. pH and microbial competition. Probiotic foods like unsweetened yogurt can shift the mouth's microbial balance in pH, helping suppress the growth of bacteria that produce VSCs when used repeatedly over days to weeks. This is usually a slower effect, but contributes to the 2-week improvement plan. Safety anchors.
Remember 2 constraints. Acid exposure from citrus can erode enamel if used excessively without a rinse. Sugar-containing snacks increase caries risk, and no food sterilizes the mouth or eradicates established disease deep in pockets or tonsillar crypts. Foods act quickly on surface issues and as diagnostic clues, not as guaranteed cures. Core instant foods, practical, evidence-framed profiles. Below, I described foods and simple edible protocols that commonly produce rapid odor reduction. For each, I'll explain the mechanism, give an exact how-to you can use in a real moment, state what to expect and for how long, and list safety notes and alternatives. Apple, carrot, celery, the mechanical scrapers. Why they help. These crunchy raw fruits and vegetables physically remove food debris and some bacterial biofilm, especially on the surfaces of teeth and the tongue's edges. They also stimulate saliva. How to use. Take a medium-sized apple or 1 large carrot stick or several long celery ribs. Bite firmly and chew in a focused way for 2 to 3 minutes, making sure to reach molars and the back teeth. For celery, break the rib into manageable lengths and chew along the fibers to catch particulates. Expected timeline. You'll often notice a measurable improvement in breath within 5 minutes. The effect is immediate but transient, typically lasting 1 to several hours, depending on subsequent eating and saliva flow. Limitations and safety notes. These foods reach mainly accessible surfaces. They are less effective for deep tongue furrows, periodontal pockets, or tonsil stones. Be cautious if you have dental restorations that are fragile or loose crowns. Hard biting can dislodge them. For people with biting or jaw issues, softer options are preferable. Alternative. If raw produce is not available, crisp rice cakes or sugar-free whole grain crackers provide some mechanical action, though not as effective as fresh produce. Parsley, mint, cilantro. Chlorophyll-rich herbs for chemosorption and masking. Why they help. Fresh herbs contain volatile oils and chlorophyll-like compounds that can bind or neutralize odor molecules and leave a fresher aroma. Their action is a mix of chemical interaction and strong, pleasant scent. How to use. Chew a small sprig of fresh parsley, mint leaves, or cilantro for 30 to 60 seconds. For maximum effect, crush them slightly while chewing to release oils. After chewing, hold saliva in the mouth for 10 to 20 seconds, and then swallow or spit followed by a sip of water. Expected timeline. Immediate sensory improvement is common. Neutralization of sulfurous notes may occur within 1 to 3 minutes. The pleasant scent persists for up to an hour. Limitations and safety notes. Herbs mask and neutralize but do not remove dense bacterial deposits or large tonsil stones. If you're relying on herbs multiple times per day, be mindful of dental hygiene and avoid sugary herbal preparations.
For allergy sufferers, avoid herbs that trigger reactions. Quick anecdote. A patient in my clinic once said chewing parsley after a garlic-heavy dinner made the difference at a networking event. The parsley cleared the sulfurous hit quickly enough that she felt comfortable speaking closely for the next hour. Green tea. Polyphenols with mild antimicrobial activity. Why it helps? Green tea is rich in catechins and polyphenols that inhibit bacterial enzymes implicated in VSC formation. Its warm water also rinses the back of the tongue and throat, loosening residues. How to use. Brew a cup of unsweetened green tea and let it cool to a comfortable temperature. Take several sips and swish the liquid across the back of the tongue for 20 to 30 seconds, then swallow. Optionally, take another smaller sip and swish again. Green tea lozenges or ready-made unsweetened green tea can be used in a pinch. Expected timeline. Some people detect reduced sulfurous odor within 10 minutes. The antimicrobial contribution strengthens with repeated use over days. Immediate relief from rinsing is noticeable. Limitations and safety notes. Green tea is safe for most people, but avoid adding sugar. Caffeine-sensitive individuals should limit intake late in the day. Do not rely on green tea as a substitute for mechanical cleaning and periodontal disease. Plain, unsweetened probiotic yogurt. Microbe competition and pH shift. Why it helps? Certain live cultures in yogurt can modify the oral microbiome and lower the environment that favors VSC-producing bacteria. Over time, consistent use may reduce baseline odor. How to use? Choose plain, unsweetened yogurt with active live cultures. Eat 1 small serving, about 4 to 6 ounces, after a meal or in the afternoon as a snack. Avoid fruit on the bottom sweetened varieties that contain high sugar. Expected timeline. Immediate sensory effects are modest. Yogurt freshens and coats the mouth briefly, but measurable reductions in VSCs have been reported in small studies after repeated daily intake over several days to 2 weeks. Use yogurt as part of the 2-week plan, not just as a single quick fix. Limitations and safety notes. Avoid if you are lactose intolerant and have noted adverse symptoms. Be mindful of sugar content. Yogurt is an adjunct to hygiene. It will not erase periodontal pockets or remove tonsil stones. Sugar-free xylitol gum. Salivation stimulation with antibacterial benefit. Why it helps? Chewing sugar-free gum increases salivation flow and mechanically scrubs the tongue and teeth. Xylitol itself reduces certain karyogenic bacteria and discourages adherence of plaque-forming organisms. How to use? Chew a piece of sugar-free xylitol gum for 10 to 15 minutes after a meal. If you are planning a brief social encounter, begin chewing 5 minutes beforehand and continue for the first 10 minutes.
Expected timeline. Salivation stimulation begins within 1 minute of chewing and provides notable odor reduction during and for a short period after chewing, typically 10 to 30 minutes. Limitations and safety notes. Avoid sugary gum. People with TMJ pain should be cautious with prolonged chewing. Xylitol is toxic to dogs. Do not leave gum accessible to pets. Do not overstate the antimicrobial effect. Xylitol helps, but is not a cure for established periodontal disease. Fennel, anise, cardamom seeds, aromatic seeds and traditional cleansers. Why they help? These seeds release strong, sweet aromatics and essential oils that mask unpleasant odors and stimulate salivation. Some also have mild antimicrobial properties. How to use? Pop a small amount, a pinch to a teaspoon, of fennel or anise seeds into your mouth and chew for 30 to 60 seconds. Alternatively, sip a small cup of warm water steeped briefly with crushed seeds as a rinse. Expected timeline: immediate masking of odor, effective for social situations for 10 to 30 minutes. Limitations and safety notes. Seeds are a masking strategy. Persistent odor from underlying disease won't be cured by seeds alone. Avoid in infants and small children due to choking risk. Watch for allergic reactions. Citrus fruits and sugar-free citrus lozenges, salivation stimulation and rinsing. Why they help? Acidic fruits stimulate salivation, and their aromatic peel oils provide pleasant scent. The increased salivation and rinsing action help clear odor molecules from the back of the tongue. How to use? Take a small segment of orange or a few bites of grapefruit, then swish the juice across the back of the tongue for 10 to 15 seconds before swallowing. If you prefer lozenges, choose sugar-free citrus-flavored lozenges and let them dissolve slowly. Expected timeline: immediate freshness and dilution of odors within a few minutes. Limitations and safety notes. Frequent exposure to citric acid can erode tooth enamel. If you use citrus for emergency freshness, follow with a plain water rinse to dilute acid. Avoid overuse and don't brush immediately after acidic exposure. Wait 30 to 60 minutes. Milk, selective neutralization of garlic odor, mechanism-based mention. Why it helps? Milk proteins and fats can absorb and neutralize certain volatile compounds from garlic and onion, reducing the odor that passes into the breath. How to use? When garlic-heavy meals are anticipated, drink a small glass, about 4 to 6 ounces, of plain milk during or after the meal. Whole milk appears more effective than skim because fats solubilize garlic volatiles, but choose based on your dietary preferences. Expected timeline: reduction of garlic-specific odor within 15 to 30 minutes in many anecdotal reports and small studies. Effects may last longer than simple rinses. Limitations and safety notes. Milk is not a universal solution for all causes of bad breath. Avoid if lactose intolerance causes digestive symptoms. Don't count on milk to solve chronic oral odor sources.
Water and hydration. The simplest, fastest reset. Why it helps? Hydration promotes saliva production and oral clearance. A hydrated mouth dilutes VSCs and reduces stagnation that fosters odorous bacterial growth. How to use? If you're dealing with dry mouth-related odor, sip plain water frequently. For immediate effect, take a deliberate swish of water across the back of the tongue for 10 to 20 seconds and swallow. Expected timeline: immediate, modest improvement for dry mouth-related odor helps maintain freshness between other interventions. Limitations and safety notes: water is supportive rather than curative for deeper microbial reservoirs. Putting it together, an instant relief social protocol you can perform in under 3 minutes. When you need discrete, fast improvement for a meeting, a date, or a conversation, here's a practical clinician-framed sequence that combines mechanical, chemical, and saliva-stimulating effects. Step 1. Quick test, 30 seconds. Do the tongue scrape sniff test. If the scraper smells strongly, proceed with the steps below. If not, still perform the steps. They help most sources. Step 2. Rinse and dislodge, 30 seconds. Take a sip of water, tilt your head back slightly, and swish for 10 to 20 seconds, focusing on the back of the tongue. Spit, if you prefer, then take another small sip and swallow. Step 3. Mechanical action, 30-60 seconds. If available, take an apple slice, carrot piece, or celery rib and chew thoroughly for 1 to 2 minutes. If produce isn't available, choose sugar-free xylitol gum. Step 4. Chlorophyll/herb chew, 30-60 seconds. Chew a sprig of fresh parsley or 3-4 mint leaves for 30-60 seconds, crushing them to release oils. Step 5. Finish with gum or lozenge, 10-15 minutes. Begin chewing xylitol gum to maintain increased saliva during the meeting and for about 10-15 minutes afterward. Expected outcome? Most people notice a measurable reduction in sulfurous odor within minutes. This routine hits 3 mechanisms: mechanical cleaning, chemical neutralization/masking, and increased saliva. A practical diagnostic note: if the tongue scrape smell remains unchanged after the sequence, and the floss/gauze test still smells strongly, the source is likely deeper, periodontal pockets or tonsillar crypts, and you should follow the 48-hour trial and consider professional care. Deeper dive: how volatile sulfur compounds form and why certain foods work. Let's pause for a slightly more detailed but still accessible view of VSC chemistry and the mouth ecosystem, because that helps explain why some foods work quickly while others act slowly. At baseline, your mouth hosts hundreds of microbial species. Many of those are harmless or even protective, but a subset of anaerobic bacteria, species that thrive where oxygen is low, such as the back of the tongue and deep periodontal pockets, metabolize sulfur-containing amino acids like cysteine and methionine.
The bacterial enzymes break those amino acids into small, volatile molecules. Because these molecules are lightweight gases, they evaporate into the mouth's airspace and are perceived as bad breath. Where the substrates come from matters. Recent meals rich in protein, garlic, onions, and certain spices supply abundant sulfur-containing compounds and leave residual oils on the tongue and mucosa. Poor oral hygiene leaves food particles trapped in the teeth or on the dorsal tongue, supplying bacteria with continuous fuel. Xerostomia, dry mouth, worsens the problem because saliva normally washes away these molecules and keeps the environment more oxidized, less hospitable to anaerobes. Now, how foods act on this system. Mechanical scrapers, apple, carrot, celery, physically remove the biofilm and trapped residues that would fuel VSE production. No surprise, remove the fuel and the smell drops quickly. Saliva stimulators, xylitol gum, citrus, chewing, increase flow and oxygenation, diluting VSEs and making the environment less anaerobic. The change starts within seconds to minutes of chewing. Polyphenol-rich liquids, green tea, and chlorophyll-containing herbs interact with bacterial enzymes or bind odor molecules, decreasing the rate at which VSEs are produced or neutralizing those already present. These actions can be immediate, binding, and develop further with repeated use, enzyme inhibition. Dairy fats, milk, and proteins can solubilize certain volatile organics, especially from garlic, reducing their release into the mouth airspace. Probiotic yogurt introduces live cultures that can compete with VSE-producing bacteria over days to weeks, changing the baseline microbial ecology. Because these are different mechanisms, combining them produces better short-term results than any single measure. A chew of parsley after an apple or green tea rinse is lant reductant. The apple removes debris and the parsley neutralizes residual volatiles, while the saliva flow from chewing continues to rinse. Case vignettes that illustrate food-based diagnosis and response. Hearing examples helps put theory into practice. Below are 3 expanded clinical vignettes that show how foods can produce rapid relief in real people, what to watch for, and how we used results to shape next steps. I'll follow each story with a short clinician script you could adapt when calling or meeting a dental or ENT office. I'm keeping patient details generic and focused on actions. Anna, the tongue coating case. Anna, a marketing manager in her mid-30s, came to the clinic complaining of recurring bad breath, most noticeable in the late afternoon. She brushed twice daily, flossed, but admitted to skipping the tongue occasionally, and drank coffee throughout the morning. At the clinic, the tongue scrape test produced a strong sulfurous odor. Flossed sites smelled only mildly. A visual exam showed a thick, whitish coating on the posterior dorsal tongue, but healthy-looking gums and no deep pockets. Anna tried a supervised sequence: tongue scraping, a warm green tea rinse, an apple bite, then chewing fresh parsley. She reported a dramatic subjective improvement within 5 minutes. It felt like someone turned the smell dial way down, she said. We recommended a 48-hour plan, emphasizing twice daily tongue scraping, sugar-free xylitol gum after meals, daily green tea, and a small serving of unsweetened probiotic yogurt in the afternoon. Anna logged her findings: instantaneous relief after the apple-parsley combo, at least 3 times in 1 week, with a gradual baseline improvement over 2 weeks. Her clinician follow-up focused on reinforcing scraping technique and discussing lifestyle changes, not invasive treatment. Clinician script Anna could use when booking or reporting. Hi, I'm Anna. I've noticed afternoon bad breath. Tongue scraping produces a strong smell. Gums don't bleed and floss doesn't pick up a strong odor. I tried a 48-hour home routine with green tea, tongue scraping, and xylitol gum and had prompt improvement. Can the dentist review my tongue coating and advise on technique and any further treatment? Marcus, the periodontal reservoir. Marcus, a 52-year-old with a history of inconsistent dental visits, reported persistent foul breath despite daily brushing and occasional gum bleeding. Floss, gauze testing showed a persistent malodor. The tongue scrape was only mildly odorous. Marcus tried the instant protocol: apple, parsley, and xylitol gum, with minimal change in the floss smell test. On exam, probing found several periodontal pockets with deep plaque accumulation and gum inflammation. Foods provided only brief, partial masking, confirming that the source was periodontal. We advised a course of scaling and root planing, and recommended temporary adjuncts like sugar-free xylitol gum for saliva stimulation and green tea rinses while awaiting periodontal treatment. After professional cleaning, his breath improved substantially, and follow-up hygiene with daily interdental cleaning and specific food habits helped maintain the change. Clinician script Marcus could use: "Hello, this is Marcus. I have persistent mouth odor that doesn't improve with chewing parsley or apples. My floss and gauze tests show a strong smell. I'd like an evaluation for periodontal disease. Can I schedule a deeper cleaning and assessment of pockets?" Leah, the ENT and sinus contributor. Leah had months of morning halitosis and a constant metallic, slightly sour smell. Tongue scraping showed little odor. Floss testing was negative. A quick oral protocol with chewing and green tea produced no meaningful change. A ventilation and throat exam revealed postnasal drip and inflamed tonsillar crypts with some debris. Nasal congestion and intermittent sinus pressure matched the history.
Leah's response, or lack of response, to the foods was a diagnostic clue pointing away from an oral surface source. After a targeted ENT evaluation, she received a sinus care plan and saline nasal rinses. A combination of ENT-directed therapy and intermittent use of parsley and green tea for social moments reduced her social anxiety about breath while underlying sinus drainage was being treated. Clinician script Leah could use: "Hi, this is Leah. I've tried chewing parsley and green tea rinses with no improvement. Tongue scrape and floss tests were not strongly positive. I have chronic nasal congestion and postnasal drip. Could I have an ENT evaluation for sinus-related breath odor?" When quick food fixes tell you more than just breath relief. These vignettes show an important concept. Immediate response to food strategies is often diagnostic. A rapid drop in odor after tongue scraping plus an apple suggests the issue is mainly the tongue surface. A stubborn smell that persists despite all the edible tricks suggests deeper periodontal or ENT sources. Document what you tried and when. Clinicians value that timeline. What I asked each of these patients to bring to the appointment: a simple log noting their floss and tongue scrape results, which foods produced immediate relief and how long the effect lasted, any medications or supplements, and dietary triggers, for example, heavy garlic meals or high-protein diets. That small documentation helps us quickly triage. Safety and red flags I watch for. Food-based strategies are safe for most people, but certain signs should prompt urgent evaluation rather than more home attempts. If you notice persistent sore throat, unexplained weight loss, persistent new mouth ulcers, significant swelling in the neck, uncontrolled bleeding from gums, or if bad breath is accompanied by persistent systemic symptoms, fever, night sweats, seek prompt clinical assessment. Also, if you have recurring large tonsil stones, talk with an ENT rather than trying aggressive at-home removal. Where we stop for now and where we'll go next. We've covered the diagnostic checks you can do in minutes, the science behind instant food effects, and detailed profiles of the most reliable edible options: crunchy produce, herbs, green tea, yogurt, xylitol gum, aromatic seeds, citrus, milk, and plain water. You now have a practical 3-minute social protocol and a sense of when food strategies are likely to be diagnostic versus merely palliative. Next, we'll walk through a full hands-on demo, step-by-step tongue scraping technique, guided sequences for combining foods with simple home routines, and a structured 48-hour and 2-week plan that integrates these foods safely. We'll also return to expanded vignettes and scripted dialogues you can use when calling a dentist, periodontist, ENT, or PCP, and we'll provide a printable log you can take to appointments.
Before we move into the hands-on portion, there's one more crucial piece to cover: how to make instant foods part of a safe, evidence-informed short-term plan so you never confuse temporary masking with successful treatment of deeper disease. That discussion includes timing, frequency limits, and how to document results for clinicians, and we'll begin that now. Start by setting up your space and tools so the hands-on demo feels simple and replicable. You'll need a clean tongue scraper, or a small sturdy spoon, a cup of plain water, a cup of unsweetened green tea, a piece of fresh apple or carrot, a small sprig of parsley or a few fresh mint leaves, sugar-free xylitol gum, and if you keep it on hand, plain unsweetened probiotic yogurt for later in the day. Lay them out where you can reach them in sequence. The goal here is to layer small, safe actions that target different mechanisms: mechanical removal, rinsing, chemical neutralization, and increased saliva, so that within 3 minutes you've given the mouth multiple complementary chances to reduce odor. The tongue scraping technique I recommend is gentle and clinical.
Hold the scraper between both hands so you have stable control. Tilt your head slightly forward, open your mouth, and stick out your tongue as far as comfortable without straining. Place the scraper as far back on the midline of the tongue as you can tolerate, usually just anterior to the point that triggers gagging. Then pull the scraper forward in one smooth motion toward the tip of the tongue. Repeat this motion 2 to 3 times, rinsing the scraper under running water between passes and checking the scraper's surface for visible coating. Do not scrape to the point of pain and avoid repeated aggressive strokes. The aim is to remove superficial debris and the darker, smelly layer rather than to abrade the tongue. If a spoon is the only tool available, use the rounded back and perform the same gentle scoop and pull action. After scraping, take a moment to smell the scraper as a quick self-test. A strong sulfurous odor confirms a tongue-dominant source. If scraping causes persistent discomfort, bleeding, or an exaggerated gag reflex, stop and bring this up with your clinician rather than increasing intensity. Next, the rinse. Warm, unsweetened green tea is my preferred immediate rinse because it combines liquid clearance with catechin-based inhibition of enzymatic bacterial activity. Brew a small cup and let it cool to warm, not piping hot. Take a mouthful, tilt your head slightly back, and actively swish the liquid toward the back of the tongue for 20 to 30 seconds, allowing the liquid to contact the posterior tongue and the throat for a moment without forcing a swallow. Spit if you prefer, and then take a smaller sip to swish a second time. If green tea isn't an option, plain water is still useful. Focus the swish on the back of the tongue to dislodge pooled residues.
Avoid sugary or sweetened teas. The sugar undermines oral health. The immediate benefit from the rinse is twofold: physical loosening of residue and a surface-level chemical interaction that can reduce volatile sulfur activity. While your mouth is still moist from the rinse, move on to the mechanical chew. Bite into an apple slice or a carrot stick with deliberate, thorough chewing. The technique matters. Don't merely crunch and swallow. Use the molars and chew longer than you normally would, 1 to 2 minutes, so the fibrous texture scrubs surfaces and generates a steady flow of saliva. For celery, break a rib into manageable lengths and chew along the grain to let fibers catch particulates. If your teeth have delicate restorations or you have a history of fractured teeth, opt for a softer mechanical alternative, such as sugar-free whole grain crackers, but know that fresh produce gives the best scrubbing effect. As you chew, imagine you're trying to reach areas where food usually hides, the grooves of the molars and the lateral borders of the tongue. Immediately after the crunch, chew a sprig of fresh parsley, a few mint leaves, or a small piece of cilantro. The technique here is to crush the plant material between the molars to release volatile oils. Hold the crushed herb saliva in your mouth for 10 to 20 seconds before swallowing or spitting. The brief holding period allows chlorophyll-like components and aromatic volatiles to interact with sulfur compounds and the mouth's airspace. Do this for 30 to 60 seconds in total. If you don't have fresh herbs available, a small pinch of fennel or anise seeds chewed briefly produces a rapid aromatic mask. The seeds' essential oils are potent and often sufficient for short social windows. Keep in mind that herbs primarily neutralize and mask. They work best after you've removed debris and rinsed. Begin chewing sugar-free xylitol gum as a finishing measure. Gum stimulates saliva within a minute and sustains increased flow for the duration of chewing. Choose a gum with xylitol as a listed ingredient and, if possible, a dose that provides at least 1 gram of xylitol per piece. Many clinical studies use 1 to 2 grams per chewing session as a practical benchmark. Chew for 10 to 15 minutes. The continued saliva flow helps clear loosened residues, dilutes remaining VSCs, and keeps the mouth refreshed during the immediate social timeframe. If you are at risk for temporomandibular discomfort, limit chewing duration and rely more on rinses and herbs. A safe 3-minute summary you can do before a meeting: 1 quick tongue scrape, a 20 to 30 second green tea or water swish, 1 to 2 minutes of thorough apple or carrot chewing, 30 to 60 seconds of parsley or mint chewing, and then start a piece of xylitol gum. That sequence applies mechanical removal first, then chemical neutralization, and finally sustained saliva stimulation, each step reinforcing the others. In most people with tongue or diet-related odor, this sequence provides a marked reduction in smell within 5 minutes. Now, let's translate that demo into a short, structured 48-hour plan that adds consistency and observation. The 48-hour plan is diagnostic and therapeutic. It lets you determine whether surface-focused measures plus food strategies will substantially change your baseline odor. For those 2 days, follow a simple schedule. Morning. On waking, perform the tongue scrape sniff test before drinking anything to get a baseline. Brush your teeth with fluoride toothpaste, perform a thorough tongue scrape as described, and rinse with warm green tea or plain water. Eat a breakfast that includes a crunchy component, an apple, raw carrot, or whole grain crisp bread, and chew parsley or mint after the meal. Midday. After lunch, floss or use interdental cleaning, swish with green tea, and chew sugar-free xylitol gum for 10 to 15 minutes.
Have plain, unsweetened probiotic yogurt as an afternoon snack. Evening. Repeat brushing, interdental cleaning, and tongue scraping before bed. Avoid eating strongly odorous foods after your final oral care session to allow overnight reductions. Throughout the 48 hours, sip water frequently to maintain hydration, and avoid alcohol or smoking if possible, because both dry the mouth and exaggerate odor. Keep a simple log during those 48 hours. Each time you perform the tongue scrape or floss test, note the time and rate the odor on a 0 to 10 scale, where 0 is no detectable smell and 10 is very strong persistent odor. Also note which foods or steps you used, apple, parsley, green tea, xylitol gum, and whether the self-test smell changed in the next 5 minutes. This documentation is invaluable. A sharp drop in your score after the apple and parsley sequence suggests an oral surface source likely to respond to continued home care. No meaningful change suggests deeper issues and should prompt the 2-week plan or a clinician visit. The 2-week plan builds on the 48-hour trial, with consistent daily habits intended to shift baseline oral environment. For 2 weeks, maintain twice daily brushing, daily interdental cleaning, twice daily tongue scraping, and the targeted food additions: a daily serving of plain probiotic yogurt, 4 to 6 ounces, at least 1 serving of crunchy raw produce daily, and 1 cup of unsweetened green tea either after breakfast or as an afternoon rinse. Use sugar-free xylitol gum after meals 3 times a day. Avoid high-sugar breath mints and minimize late-night snacking that leaves residues overnight. Keep citrus to limited emergency use, and always follow a citrus exposure with plain water to neutralize acid. If you are taking medications known to cause dry mouth, add scheduled sips of water and consider sugar-free lozenges that stimulate saliva. Document medication names and dosing because clinicians will need that information if odor persists.
Over a 2-week period, monitor trends rather than a single data point. If your average daily odor score decreases and you achieve consistent immediate reductions after the food routines, the problem is likely hygiene or diet related and manageable with ongoing home care. If scores remain high, or there are days with sudden spikes unrelated to food intake, or if you identify specific triggers, for example, a particular time of day or a type of meal, bring that log to your dental or ENT appointment. Even a short 1-page printout with dates, times, pre- and post-intervention scores, and notes on foods or medications can accelerate clinical diagnosis. A few practical menu and timing examples make the 2-week plan easier to implement. Breakfast might be whole grain toast, an apple or a small carrot, and a cup of unsweetened green tea. Mid-morning, water or a herbal tea, and if you need a snack, a small container of plain yogurt. Lunch, chew thoroughly, perform interdental cleaning afterward, and chew xylitol gum for 10 to 15 minutes. Mid-afternoon, quick tongue scrape and a handful of fresh parsley with water. Dinner, avoid heavy garlic or onion just before an extended social event. If you do consume such foods, plan the milk strategy described earlier, a small glass of milk during the meal, and follow with the demo sequence. Night, brush, floss, tongue scrape, and avoid additional food unless you rinse and repeat the oral care steps. To illustrate how this structured approach plays out, I'll expand 3 more clinical vignettes that show typical responses and how clinicians incorporate the food-based evidence into care plans. Case vignette: Daniel, the professional with coffee breath and medication-induced dry mouth. Daniel is a 44-year-old software engineer who drinks several cups of coffee each morning and takes a selective medication for a dermatological condition that has the side effect of reduced salivary flow. His complaint was persistent stale breath that felt worst mid-morning. On testing, his tongue scrape was moderately positive, and his self-rated odor improved immediately after a green tea rinse and a vigorous apple chew, but the effect faded within an hour. The pattern and his report of dry mouth between cups of coffee pointed to saliva deficiency as a significant amplifier of odor. We advised scheduled hydration with plain water, sugar-free xylitol gum after coffee, third spacing of caffeinated drinks with decaf alternatives, and evening use of a saliva-stimulating lozenge as needed. He kept a 48-hour log showing immediate improvement after the demo routine, but persistent mid-morning spikes. This helped his prescribing clinician review his medication list and consider alternatives or adjunctive saliva-supportive measures. The takeaway: foods and chewing strategies gave immediate relief and, combined with hydration and medication review, reduced the frequency of odor spikes.
Case vignette: Priya, the social presenter who needed a reliable pre-meeting routine. Priya is a 29-year-old public speaker who noticed that her breath felt off during afternoon talks. Her self-tests showed a mild tongue coating and occasional strong smells after cilantro-heavy lunches. After practicing the 3-minute protocol before talks for a week, tongue scrape, green tea swish, apple chew, parsley chew, then xylitol gum, she reported consistent control during presentations. Over 2 weeks, with added daily probiotic yogurt and interdental cleaning, she noticed a lower baseline, meaning that her pre-talk prep required less last-minute action. The clinical lesson: a predictable routine that pairs immediate foods with daily habits can convert an anxiety-inducing problem into a manageable one. Case vignette: Omar, the smoker with periodontal pockets who needed professional escalation. Omar, a 57-year-old with a long history of smoking, showed little change on the floss sniff test despite immediate masking from herbs. The apple and parsley routine produced temporary social acceptability, but the floss and clinician exam revealed deep pockets and bleeding on probing. For Omar, foods were only adjuncts. They never reached the roots of the problem. He required periodontal therapy, scaling and root planing, along with smoking cessation support. His case reinforces the diagnostic value of food response. If foods and mechanical home measures don't meaningfully change clinician-observed indicators like pocket depth or interdental odor, professional periodontal care is the next step. When you do decide to see a clinician, make the interaction efficient by bringing clear documentation. A practical one-page log should include dates and times of self-tests, pre- and post-intervention odor scores, a list of foods tried, any medications or supplements you take, including dose and timing, tobacco or vaping use, and a short note on whether the odor is constant or episodic. Clinicians appreciate specifics. Instead of saying it sometimes smells bad, say the tongue scrape smelled strongly on waking at 7 a.m. on 3 consecutive days, and the apple parsley routine lowered the score from 8 to 2 within 5 minutes on 2 of those days. This lets the clinician focus the exam and order appropriate tests or referrals rather than starting from scratch. Here are clinician-facing scripts you can adapt when calling your dentist, periodontist, ENT, or PCP. For a dental appointment request: hello, I'm Name. I've had persistent oral odor. My tongue scrape test shows strong sulfurous odor, while floss or gauze smell is mild. I've tried a 48-hour regimen of tongue scraping, green tea rinses, and xylitol gum with immediate improvement after the apple and parsley routine, but a high baseline in the mornings. Can I schedule an exam and periodontal screening? For a periodontal referral: hello, I'm Name.
My floss test produces a persistent foul smell, and I have bleeding gums. Home measures have not resolved the odor. Can I get a periodontal evaluation and possible deep cleaning? For an ENT referral: hello, I have chronic nasal congestion and postnasal drip with morning halitosis. Tongue and floss tests were not strongly positive, and food-based measures like green tea and parsley did not help. Can I schedule an ENT assessment for sinus or tonsillar causes? For your PCP when you suspect a systemic driver: hello, I've tried a 2-week oral hygiene and food-based routine without sustained improvement. I have morning nausea and a metallic smell at times. Can we review medications and consider relevant systemic tests? Expect certain exams and tests when you arrive. Dentists will typically perform a periodontal probe to measure pocket depths, examine restorations for leakage, inspect the tongue and tonsils, and may take bite-wing radiographs if periodontal or dentally related reservoirs are suspected. Periodontist will focus on pocket mapping, bleeding on probing, and may propose scaling and root planing. ENTs will inspect the nasal passages and sinuses, evaluate the nasopharynx, and look at tonsillar crypts. They may suggest nasal endoscopy or imaging if sinus disease is suspected. Primary care physicians will review medications and systemic contributors and may order blood work if they suspect metabolic causes. When clinicians propose interventions, whether a deep cleaning, an ENT-directed sinus regimen, or medication review, ask how the proposed treatment will interplay with your home routines and the food-based measures you've been using. Safety reminders to carry forward: do not try to dig or dislodge tonsil stones with sharp objects, and do not undertake unsupervised aggressive mechanical manipulation at the back of the throat. If tonsil stones are frequent and symptomatic, an ENT can discuss safe in-office options or medical management. Avoid prolonged daily use of strong antiseptic mouthwashes without clinician guidance. Agents like chlorhexidine are useful short-term, but can cause staining and taste disturbances over long-term unsupervised use. If you have acid reflux, diabetes, or chronic sinus disease, mention these conditions because they change both underlying causes and optimal treatment approaches. Never stop or alter prescribed medications without your clinician's direction. Instead, document the medication and ask whether it might contribute to dry mouth or odor. A practical printable log template is simple to describe and implement. For each day, write the date at the top and create 4 timed entries: morning, midday, late afternoon, and evening.
Under each entry, record the tongue scrape result, odor rating 0 to 10, the floss or gauze result, if performed, foods consumed in the prior 2 hours, steps taken, scrape, rinse, apple, parsley, gum, the immediate post-intervention odor rating, and any symptoms, such as dry mouth, sore throat, or sinus congestion. At the bottom of each day, add a short note: subjective overall freshness today, better, same, worse, and notable triggers, e.g., garlic lunch. Bring 2 weeks of these pages to your appointment.
They provide a rapid narrative of what helped and what didn't. Let's return briefly to safety and enamel health, because some food measures require restraint. If you use citrus fruits to freshen breath, don't brush immediately afterward. Enamel softened by acid is vulnerable to abrasion. Instead, rinse with plain water and wait 30 to 60 minutes before brushing. Similarly, do not substitute sugary mints or candies for sugar-free alternatives. The quick reward of sweetness is offset by caries risk. For those with sensitivity issues or high caries risk, consult your dentist before making frequent, routine changes in diet solely for breath control. There will be occasions when immediate food-based tactics are insufficient in the short term, and clinician intervention is non-negotiable. Red flag scenarios include rapid onset of new persistent foul odor accompanied by systemic signs, fever, unexplained weight loss, night sweats, or local signs, significant neck swelling, persistent throat pain, visible pus, bloody discharge, or rapidly enlarging tonsillar lesions. These warrant urgent evaluation. Also, recurrent large tonsil stones, uncontrolled gum bleeding, or sudden changes in taste perception should prompt faster than routine appointments. Now, a compact clinical checklist for sustainable daily practice. Scrape the tongue gently twice daily. Clean between teeth once daily. Drink plain water regularly. Use sugar-free xylitol gum after meals. Incorporate at least 1 serving of crunchy raw produce each day. Include unsweetened probiotic yogurt daily if tolerated. And routinely use herbs like parsley or mint as situational adjuncts. Combine these habits with intermittent green tea rinses and a conscious reduction of behaviors that dry the mouth, such as heavy caffeine late in the day and smoking. The point is to make small, sustainable changes that shift your mouth's baseline ecosystem rather than relying solely on emergency masking measures. Before we close, I want to return to the title promise in a clinically honest way. Certain foods and edible routines can produce rapid reductions in noticeable mouth odor for many people. They work by removing debris, stimulating saliva, neutralizing or masking odorous molecules, and in some cases by changing oral microbial activity over days. For most diet or tongue-related causes, the combinations I've described produce visible, measurable improvements within minutes.
For deeper reservoirs, periodontal pockets, tonsillar crypts, sinus drainage, or systemic contributors, foods are adjunctive. They can help you feel more comfortable and may mask odor temporarily, but they won't replace professional care. If you try the sequences we discussed, make a habit of documenting what you did and how your self-tests changed. That documentation will make any subsequent clinical visit far more productive. If after a careful 48-hour and 2-week trial you still have persistent odor, or if you notice any red flags we discussed, schedule an evaluation with a dentist or ENT. Use the clinician scripts and the log format as tools to communicate the pattern efficiently. If this guide helped you and you'd like a step-by-step visual demonstration of the tongue scrape, green tea swish, apple chew, parsley crush, and xylitol gum sequence, the hands-on demo linked with this video walks through every motion so you can practice confidently. Otherwise, start with the 3-minute protocol today and document your results for 1 week. If the odor persists despite careful home care and food strategies, bring your log to a dental or ENT appointment and use the clinician scripts provided to get focused help.